Hi, my name is Paras Mehta. I wanted to bring this conversation to a local level. I'm CMC's first integrative medicine fellow. I've trained with Andy Weil, trained with Richard Niemzow, who was the battlefield acupuncture physician who was featured in the video. And I just wanted to make a comment on momentum and where we see some of these initiatives here in Charlotte. We see with the by combining a few of these modalities, we see some of these outcomes on a weekly basis now at CMC, both on the inpatient side and on the outpatient side. And when I'm looking towards the future as far as incentivizing a system or either of the systems in town to make these kind of integrative modalities a permanent fixture, I'm still not sure the market really supports that. Furthermore, with cardiologists that I've had conversations with to try to get Ornish implemented in town, which is paid for, I still don't see the market supporting that. So I'd be curious as far as whether you see any of the healthcare changes in 2014 supporting that, or how to break that fundamental wall. It's what Wayne Jonas said, where 15 years ago we knew about the efficacy of acupuncture. 15 years later, we still can't get it in the hospital, but for a few places. How do we have a tremendous wealth of talent locally. How do we leverage that?
Yeah, I found that with my own patients. It's because I love the word integrated medicine, not alternative, because it's all part of one whole. And like how Andy Weil puts it, it's really a system to help the patient get better in the most cost-effective way. And I think the way we're going to get to it again is with economics. And that is that old economics equation. I think everybody is the second most important equation besides supply and demand. It's value is quality over cost. And I think in the past, a lot of us thought the value was getting a stent in your left main, and that's prevention. Now I think the value there is with Dean Ornish and meditation and the right medicines at the right time. I think it's like Alan said, though, it's going to be a quiet change because you're pushing the economic bubble to do that right now because money is made in a different way. I think as CCNC has proven that it can save $5 million or $1 billion and keep it flat over a period of time when other systems arise, or when Safeway saves 40%, or when you look at groups across the United States who only see Medicare patients and have saved 40% for Medicare, those things are going to be seen. And they're doing things with integrated medicine, with Dean Ornish, with team care. And I think it's beyond just integrated medicine. It's physicians realizing now that the old model was a physician would sit in a room and a patient came to see the physician. The physician was basically disintegrated with, they weren't integrated with other caregivers. They would do their thing and strike their pin, and a lot of things happen that may not make sense. Now I see the physician, especially the primary care physician, as more of an offensive coordinator. And I think somebody mentioned it there. And you have integrative folks that are part of your team. You have psychologists, you have nutritionists, you have diabetic educators. And you really wrap that whole team around the patient. And in the systems that have made the most sense and have moved the dollar where Medicare can see it, integrative medicine is a big piece. I just see that over the next 2 years that's going to become something that we pay for.
Yeah, I think you're hitting to a key problem we have in moving policy is we know what needs to be done, but we have a problem getting credit for the utilization change. Right? What you're talking about doing is good for patients. It needs to be paid and expanded, but the value is reducing the number of units that get done on patients over time, right? And unless you get credit for that, and it becomes valued, then there's not going to be the real uptake. Your lone voice and will. So it's back to what you're saying. We've had this argument for decades of saying, we know we need to pay for primary prevention. We know that. I mean, it slaps you in the face, but why can't we pay for primary prevention? Well, there's no money. So how are we going to get the money when and I'll tell you, I've had a talk with the Senate and the House in the last Tuesday. There's no more money. So you got this much money. So how do you pay for primary prevention? Well, you save it on tertiary and secondary prevention, right? You save what they're talking about, but you got to consciously move it to where you know you're really going to make the value. And I know you've really been a champion of prevention and in that part, but somehow we've got to, connect the dots so that, we reinvest the money that we save versus taking out and putting it someplace else.
And this is not a bad thing in reference to our systems, both of our systems in this community, but it's a reality. What we're talking about is something that would decrease the revenue of the hospitals. And when you decrease the revenue of the hospitals, and hospitals are oftentimes paying for the other things that are happening, how do you make that shift and get to the place where you're like this before and not having something to topple over? And the reality of it is too, when you talk about the cardiology and what you'd like to see happen, the same thing. We've lived in a world that's capitalistic. We live in a capitalistic society. John Baker talked about earlier today that he was a socialist. I know Jessica Sachs has done a lot of hard work in reference to trying to get people to look at a single payer and the kinds of things we need to do. We have to all be on the same page. And as physicians, we're not all on the same page. And I think that that's part of why we can't get to the places we need to get to as soon as we need to get there, because we ourselves are not on the same page. I'm not a person who would advocate lobbying, I think, but when I was the president of the Mecklenburg County Medical Society a couple of years ago, when I served there and had the opportunity to go to DC for those 2 years of when you're the president and then the immediate past president, I got to see a lot of things. And I got to see that if we were together, there's value in going there together. There's value in doing those things together. And right now, the system we have